Well, we seem to have resolved our technical difficulties this morning. So I'm going to go ahead and call the meeting to order at 10:37 a.m. Thank you all for coming. For the record, let's do a round of introductions. I'm Nancy Wise, Commissioner and Chair.
Pat Malone, Commissioner.
Ann Thwaites, PIO.
Damon Sands, Behavioral Health Director.
Rachel McInerney, County Administrator.
Lacey Noel, CHC Executive Director.
April Holland, Health Department Director.
Julie Arena, Benton County Health Department and Coordinated Homeless Response Office.
Rebecca Taylor with the Coordinated Homeless Response Office in the Benton County Health Department.
Good morning, Sarah Hartstein, Public Health Division Director.
Morning, Rick Prager, Assistant County Administrator.
Gabe Shepard, Commissioner.
All right. First on the agenda, I have the federal update with Lacey Below.
Very fun. I want to just start with a precursor that okay, I did hit the button, but just to let you all know that this information is changing in real time. I think on Thursday, there was a draft document of the HHS budget that was being proposed for FY26 that was leaked. And so I won't go into the details of it, but some of it kind of is, you can see kind of play out in the presentation, and then some of this information won't be quite as relevant because there's some things that we're learning. So
Is this the House?
no, this is just the department proposed budget. So what they were proposing from the Office of Management Budget. So of course, this will go to the House, right, for funding, but this is where their kind of priorities are at right now. So this is just a list of partners and sources where we get our information from. Most everything that we share doesn't come from news media, but rather folks who are, with it. I don't want to say insider knowledge, but people who are very close to what's happening in DC and are helping us be able to respond to things. So,
I'm sorry to interrupt. Online is not showing the same version as what's on our TV.
Of course not.
Definitely, it's not the first time it's happened. It happens frequently. Let's go ahead and just share the entire. It's not allowing me to share.
Do you have to click on the screen?
Oh, maybe.
Yeah, sorry, that's.
Thank you. And then we were here. Perfect.
If you just click over there, the little PowerPoint guy at the
Oh, it's
bottom.
right here.
Yeah, it'll start right there. Perfect.
Perfect.
Is that what you see now online?
Yes.
Okay, perfect. Yay. All right, we learned something new.
Thanks,
Teamwork.
Every day, yeah. So what has come to our attention recently over the past couple of weeks, HRSA, or HHS rather, sent out its update for reorganization and how they are planning to organize things. It's a lot more clear in that draft budget document where things are going to finally wind up landing. But in terms of Health Resource Services Administration, which is where the CHC's funding comes from, we're being folded into a new agency called the Administration on Healthy America, for a Healthy America, or the AHA or the AHA agency. Other departments that are being pulled into this new administration includes OASH, which has Title X funding the Office of the Surgeon General, and Healthier People 2030 initiative. And that was all pretty clear in that draft document also. SAMHSA also, which was previously under HRSA, which is the Substance Use Abuse and Mental Health Services Administration, is also being folded into this new organization. As well as the Agency for Toxic Substances and Disease Registry, or ADSR, and a branch of the CDC that is used to study occupational health and hazards is also being pulled in there. It does wind up being the biggest HHS agency with all these new programs that are being pulled into it. Also, in the last couple of weeks, HRSA implemented 10,000 new FTE layoffs, or reductions in force, from the Bureau of Primary Health Care, where the health center program lives. Several whole offices or divisions were eliminated that do impact the work that we do on a day-to-day basis. One of them being the Office of Strategic Business Operations, which is just all the technical support that we receive, from answering the phone when people call, to updating a website, to processing our paperwork. So we have definitely been experiencing a delay in customer service and responsiveness. And then the Office of Health Center Innovation Oversight was also eliminated, and this is where supplemental grants to those base CHC level grants are all managed, including the Justice Improvement Grant, the Quality Improvement Grant for Justice Involved populations. So we are just being kind of shuffled around with some new project officers and things like that. Other updates from HHS, they eliminated 5 regional offices. So Boston, New York, Chicago, San Francisco, and Seattle all received RIF notices. It says this week. It wasn't this week, sorry. I thought I caught all those, but it was about 2 weeks ago. Offices that are remaining are in Philadelphia, Atlanta, Dallas, Kansas City, and Denver. For us and how this impacts us, we're a part of Region 10 for Health and Human Services Region 10. And so a lot of the technical support that programs that are managed or funded by federal agencies are kind of being collapsed a little bit. And so we're not entirely sure how our support will come, if we'll be folded into, like, will it be Region 8 and Region 10? Will it become, Region 8, Region 10, and Region 9, where it's the whole Western United States are one region? We're not entirely sure, or if it won't be geographically based support anymore. But several folks that we work really closely with recently are no longer with HHS in the Seattle office. Other department updates. HRSA's Bureau of Health Workforce and the HIV/AIDS Bureau were also hit with significant reductions in force. We're still kind of waiting to see how all of that plays out. There's a lot of technical support for various programs there. Roughly a little bit more, almost half of SAMHSA's staff were reduced. A couple of programs, which are, by the way, in this new budget document, but the maternal mental health hotline and the quit smoking hotline were both impacted by the reductions in force, in that the departments that oversee them are no longer there, but they were included in the proposed budget, so they are being absorbed somewhere. So those supports are really important for folks. I won't spend a lot of time talking about this, as I know that you all, or actually I can let you talk about it a little bit, but you are aware that at the end of March, the federal government halted being able to use about $11 billion in COVID era funds. Oregon, along with a couple of other states, did file a temporary restraining order, which has now been replaced by a different type of restraining order. The words are not at the top of my brain right now. And so whether or not folks are able to continue to spend down these dollars or not remains in question. I think the advice from, or the direction from OHA is don't spend right now. Is that correct?
That's correct. So they had a hearing date and the temporary restraining order is extended. They need more of the argument around how this is in conflict with the Constitution to file a temporary injunction. That's my understanding. So we were told to pause spending by the state. Then the spigot was turned back on again, and then they turned it back off again. Now it's off, and the state inquired whether it would be helpful if it was turned on for the period of the temporary restraining order and pending injunction. So just a
TBD.
please.
Right. And I'll add, oh, Damien, you have some to add on the behavioral health side.
Sure. So because this just has relevance to our later discussion, and that is we were the recipient of $1 million, just under $1 million, like they have 800,000 out of OHA that they designated from ARPA funds. We actually got an email last week from Ebony, who is behavioral health director, saying, please make sure that these funds are expended by September 30th. And we got a follow-up email this morning saying, hey, did you guys get the money? And we did. So finance has already gotten back to them and say, so it's clear that they're both making a statement on the behavioral health side in terms of have you used these funds and getting confirmation that yes, they've been used. So it's all very much in movement. But the good news is that yes, we've encumbered the 1,000 basically. So,
That's fantastic.
yeah, it's not that much.
Don't you get a temporary restraining order with an abusive spouse?
Can you get a temporary restraining order for an abusive spouse?
Yeah.
I mean, I would assume, I will not speak to, I think we do have a JD in here, but I'm not that one.
Just wondering.
Yes,
They
I
can apply
believe,
to all
yes.
sorts of things,
Yes,
I guess.
yeah.
Write that down.
So other updates, HHS released only partial Title X funds to most grantees. And we do receive the health department, public health department is a recipient of Title X funds. And we did receive our notice that we were only going to get about 40% of those funds. And if you read into this proposed budget, that tracks about right. It'll probably wind up being less than that as we go into federal fiscal year 26. But they also, through the process, zeroed out all Title X funds that were previously being given to Planned Parenthood as a provider of Title X funds, which they do a lot of that. That's their primary work that they do. And just of note, something that's kind of interesting is just that Oklahoma and Tennessee had both been excluded by the Biden administration of being able to receive federal Title X funds because they didn't provide comprehensive pregnancy options and counseling that included abortion if individuals asked for referrals. And they have now been brought back into the fold and were also distributed Title X funds under this most recent disbursement. So
Was it at the same percentage? Or
40%.
They also got 40%.
Yeah, 40%. So earlier this month in April, early in the month, CMS and NIH were both given a directive to reduce spending by 35% beyond the reductions in force that have already gone into place. And in this case, they're asking them to really look at programs and grants that are being funded. And so essentially they've given them about between 15 and 30 days to explain what they're going to do. They will have to go through full termination of those projects or programs within 60 days, according to the request, or are these requests or demands? I'm not sure, by DOJ, but they're expecting similar mandates across all of the health and human services agencies here shortly. You can see those reductions pretty clearly in that draft budget document also. So other important news in health and human services, Peter Marks, who was the top FDA official overseeing vaccines and gene therapy, resigned after, being told essentially that if he didn't resign, he'd have to step down. There's been a lot of conflict over vaccines with a lot of things. The FDA is another one that's really struggling quite a bit, but with the measles outbreak that's happening in the Midwest right now, and what steps and plans should be being put in place to prevent a bigger outbreak or worse, which none of us want to see, but other things of note, things that we were told about how it would happen early on back in January and now kind of seeing play out, but top leaders and NIH have been being reassigned to Indian Health Services roles and are, being forcibly either resign or they have to move out to Indian Territory to work in person because remote work is no longer allowable under HHS. And then, of course, the FDA has had major big layoffs happen this month as well, and really a lot of knowledge and tenure, a lot of understanding has kind of walked out the door, and there's a lot of concern about how effective the FDA will be going forward. Some things that are really relevant to the work that we're doing, there's new requirements for drawing down funds for all federal funds, but we received this notice as well a couple of weeks ago, where previously you were able to just, your funds were in the payment management system. You were able to just draw down your monthly, whatever allotment that you normally do, and then the funds would come in a short period of time. Now you have to provide written justification. And then there's another aspect that is beginning. We knew that it was coming, but we learned late on Friday that additional documentation. So just kind of that, I don't want to say forensic level accounting, but they want to know hours worked, who is being specifically applied to each individual drawdown as opposed to your normal annual budget. And the only folks that are able to release funds right now are appointed staff by DOJ. So there's major delays in getting payments out. So they're telling word to health centers is, expect your cash on hand to start to dwindle quite a bit because the intent is to delay payment as long as possible. Carryover funds for all HHS grants don't look like they're going to be possible for us to continue to do those kind of no cost extensions or things. So we'll be under quite a bit of pressure to spend every dollar within the allotted time frame because those funds will be clawed back. And then we talked about this, I think, during that very first meeting when we met with you guys, but there's this convenience clause that's being exercised right now, which is just where individual grants are being canceled due to no longer effectuating agency policies. So basically, the values of the grant and the values of the federal agency no longer align, and so they're drawing terminating those contracts. HRSA is adding new language to all community health centers notice of awards. They've been doing this with all new awards that are being issued. This is just a highlight of what the new verbiage is, just letting you know that you have to Continued support for the award may be subject to programmatic considerations to the extent permitted by law, including but not limited to just the administration's priorities and court orders. Court orders being new, because that wasn't something we generally had to worry about before, but now almost everything we do is tied up in some sort of legal battle right now, so. Other things, there's been some communications that came out in the last 10 days directly from HRSA or CMS or HHS. The first of which we'll kind of highlight here, has been the Ryan White Fund. So I don't know if you're familiar with the Ryan White program, but it's grantees from the HIV and AIDS Bureau of Health and Human Services. The Ryan White program provides funding for treatment for HIV and AIDS. It's been huge in terms of basically getting us where we are as a nation in terms of control over HIV. But they issued a statement not stating that you can't use it for gender affirming care. However, just making it very, very clear that you have to be, that those funds cannot be used for anything other than these very specific evidence-based treatments of HIV and AIDS and or improving the quality of life for those living with this disease state. So again, saying it without saying it, I don't know. Do you have to add something?
Oh, I'm just saying that improving quality of life.
Yeah.
Involved
Gender affirming care, yeah. The Supreme Court, so there was a case that was heard at the Supreme Court the week of April the 7th, which may have relevance to all of us, and that has to do with North Carolina, an individual who's a Medicaid recipient in the state of North Carolina sued because Planned Parenthood was excluded as a state Medicaid provider because they do offer abortion services. So the state made the decision to exclude Planned Parenthood entirely as being eligible to become a Medicaid provider. This patient sued, and it's gotten its way to the Supreme Court to essentially be able to get services, Title X services, so reproductive health, family planning services from whomever they would like to, if they're eligible to be a Medicaid provider. So this is a big deal, as you know, Medicaid programs, while they're funded by block grants, states determine how those funds get to be spent. And in more conservative states where it's used to kind of use those funds to steer the agenda, if this does go in the favor of the individual, would go a long ways in terms of protecting providers to still be able to provide services that may not necessarily be approved of by the courts. And then this letter here to state Medicaid directors was also sent by CMS, including OHA, just letting them know specifically about gender affirming care for minors, saying that CMS determines what they'll pay for in terms of being Medicaid eligible services or not. So it's just kind of writing on the wall, so to speak, for whenever policies start to come out. And this relevant to some of our discussion today, but CMS sent a letter also to 1115 state waiver states. So the 1115 waiver essentially allows states to spend Medicaid dollars on programs, not traditional medical programs, to help improve outcomes for folks, health-related social needs. And Oregon's 1115 waiver has been approved through December of 2027, but they let everyone know that they're not looking to extend or offer any additional $1115 beyond 2027. And I know we're at time and you all have the PowerPoint, so I'll let you kind of go through this. A lot of the rest of this has to do with what's on the docket for Congress. But just this last thing of note here that I will point out is that last Monday, President Trump initiated his first rescissions plan to Congress to claw back funds from NPR, PBS, USAID, as well as what's the after-school program? Head Start and Low Income Energy Assistance Program. And so we talked about this really early back in February about that this is how you can circumvent around the Impoundment Control Act. And so whenever the programs themselves get eliminated, now those funds are unobligated, and then they're able to start pulling those back. So this is what happens when grants get canceled. Now they need to pull the money back in, and it's a fairly straightforward process. It only requires a simple majority vote, and it's about a 45-day process. So just putting that out there. And then the rest of this is about the upcoming budget and where the shifts could happen to Medicaid, but I won't go into all that. Does that sound okay? If you have questions, you're free to reach out. I don't want to take up too much of our time. And I do just want to take 2 minutes. This is just a really brief introduction for you all about an 1115. You can stop sharing that. An 1115 waiver.
I mean, before we jump into that.
Yeah, sure. Oh, yeah. Any questions?
Commissioners have questions on this.
Yeah.
That was a lot of information, so I know I'm trying to digest it all.
Well, you just mentioned a majority vote in Congress, Senate, House, or?
It has to go through both the House and the Senate for that simple majority for the clawback for the, yes, yeah, has to go through both, but no option to filibuster.
So they can't filibuster?
No.
None of my questions you can answer.
You're probably all questions you're thinking.
They're not.
Probably can't answer.
Yeah, and yeah.
Would you say this is similar presentation that your colleagues who do this type of work are also presenting?
Oh, yeah. Yes. They have different audiences than we do.
Yeah.
But certainly, yes. I think the interesting part is having now done this for the last 3 months is that the information we're getting, it's a self-fulfilling prophecy, but not really, because it's all been written down in a document called Project 2020. It's all being brought forward. So.
And can you share with this group how our staff is feeling about these?
Well, folks, the feedback I get is that people are very happy for the information. We're trying to give information to people as often as we have an audience to share it with folks. But I think that there's a lot of, there's anxiousness. Folks are anxious about the services that we provide. Will we be able to continue to provide all the services that we have historically been able to provide? And then there's a lot of uncertainty just around if, the federal landscape will lend for our ability to continue to exist as we do now, the size, and whether or not we'll be able to continue to fund all the programs where staff are funded out of. So.
Feeling a lot of disbelief, and I feel like I'm in a parallel universe.
Okay.
Yeah, a lot of anger.
Yeah, on a lot of these uncertainties and you mentioned the court's role. Most of the time, going through the courts is a slow process. I mean, different levels, and so a lot of the evil intent can be tied up in the courts? Is that,
I was on a webinar on Tuesday from Feldsman, the attorney group, the legal group that represents a lot of federal grant programs. And they shared that as these lawsuits are either A, being pushed back down to lower courts or overturned, or what they're finding is that they are not being filed in the correct court for the complaint that's being brought. And so they spent quite a bit of time talking through that and walking through what type, particularly the audiences, as things progress, is legal action something that CHCs want to take? Is legal action something that states should be taking on behalf of community health centers? Granted, this is their target audience in this particular webinar. So really trying to walk people through making sure that we're doing the right thing in the right place, because that will determine whether or not we're able to move forward. But the caution that folks are really putting out there is whether or not the administration intends to abide by the court's mandates or not, and whether or not grantees are in a space financially to sustain 12, 18, 24 months without funding, because funding itself could just be withheld for that long, whether or not you can continue to operate without the dollars, if you might get them down the road or not, you really don't know. Yeah.
My belief that the rate of chaos being caused far outpaces the rate of the courts being able to.
Yes, yeah.
And if you're a convicted felon who's had no consequences, why would you care?
is there, at last count, our Attorney General has 13 lawsuits. Is there any coordination between the clinics and the attorney, or the state Attorney General?
Yeah, there's some efforts going on right now, actually, to coordinate amongst all Oregon's community health centers. And we do have a seat at that table. Us, along with Multnomah County, are all in terms of preparing for that conversation and coming up with our, request for support. Should the dotted line be passed to us to say that we are or are not going to be able to abide by certain terms and conditions, and whether or not the Attorney General is willing to support the health centers through that process. Again, the big question is whether or not the health centers across the state of Oregon, we're all in different positions financially, can sustain long-term length of time without access to their federal funds or not. And losing federal funding and losing federal designation are two different things. And so those are questions we're trying to also figure out, because we have access to a bigger bucket of reimbursement based off of federal designation. So if that goes away, then that would be a much more serious conversation that we'd be having.
Yeah.
A little, go ahead.
Sorry, I just wanted to add, going back to the planning and strategy from a health services perspective, Lacey and I and other leaders across health services have embarked upon sort of a prioritization of work, not unlike a COOP plan, to outline and get really clear on what stems from a federal source. These things go through so many pipes that what comes out at the end might be an interesting journey to untangle what stems from a federal source, as well as outlining the bodies of work that are required and prioritized, so that if we do and when we do see cuts, we're as prepared and as possible and are being planned for. And as we, go down the road and in this work, we'll absolutely be sharing that with managers and staff.
Thank you.
And next time, at the end of your report, give some happy news.
Yeah.
Leave us
News
with
is next.
Absolutely. So I just am gonna send this down here. You guys can keep a copy of this. I just wanted around the 1115 waiver for, it's just, I just printed 3 for the commissioners. Sorry, everyone. I can email it to all of you. But just, we'll be coming to you on May the 5th or 4th or the 5th, the 6th, May the 6th. May the 4th is a Sunday, May the 5th is a Cinco de Mayo, and then May the 6th to talk to you about an opportunity for grant funds or their capacity building dollars from OHA to be able to provide primary care and services, primary care, behavioral health supports, and treatment and pharmaceutical support inside the jail for folks who are going to be eligible to have their Medicaid extended for the period of time that they are in jail, if they're within 90 days of being released. And then really it's just, some additional funding for us to be able to really hone into this space of helping folks who are leaving the carceral setting be set up for success as they are reentering into our communities. So the Sheriff's Department will be co-submitting that with us, but I just wanted to bring that to your attention. It is really an investment into, it's a pilot, to be able to start those services in January. And by start, it really is have the ability to bill for those services to Medicaid. So making some initial infrastructure investments. So then, we can work on that revenue generation, which I know that you guys are responsible for a lot of the care that happens inside the jail. So this hopefully will be an opportunity for us to capitalize on some reimbursement.
See, that's what I was talking about.
Yeah, that's good news. Yeah. At least through December of 2027.
Take it. Any questions on that? Hearing none. All right. Next up, our Coordinated Homeless Response Office update. Julie and Rebecca.
Rebecca, using the formal process of.
Do you need this?
Oh, yeah, you want to drive? Sorry,
Does
what?
that work for you, Sam?
So using the formal process of I relinquish my time, I'll be able to fly through my slides. So
Okay, yeah, thank you.
because I know you've got a lot to cover. So.
We do.
Can I take the reins? Does it work? It does. Okay.
Yeah, go ahead. Feel like it's been a while since we've been here.
Yeah, it's been a while since I've been here. There's a lot happening, as always, in the Coordinated Homeless Response Office. And really, it's a pleasure to work, to be involved in this work, to work alongside the folks doing this work on behalf of the county and the systems that is impacting. I'll just let you two take it away and let me know if I can help support. I'll jump in if needed, but you've got it. Thanks.
Thank you. And Julie prepared the slides and the agenda for us today, so if you don't mind taking us through a little bit. It's a bit of a wild ride, so we're going to try to organize it in the beginning, but we might get off track in the midst. So lots of stuff to cover.
I'm going to try to compartmentalize what we just heard about the federal level.
I'm sorry. Should have gone last.
And focus on what we do have some control over here at the local level. This is in our zone of control, and a lot of this is state funding. So Commissioner Malone, this will be some good news that we have been able to bring to you today. This is just an overview of what Rebecca and April and I are going to cover. our flexible housing subsidy pool, our FHSP, that's our new housing program, to try to target unsheltered folks and get them into housing. The growth and the progress there, the staff capacity that we've built here, our contracted partners, and then a bunch of supportive and collaborative partners that we aren't contracted with, but we're working with daily or weekly. And then the number of households as a community that we've been able to house. Some funding, state funding and capacity building, more funding that we are going for that we do know has some stability with it from the state. An update on the outreach and engagement with property managers that we're doing here locally, and it's been very collaborative with our partners at the City of Corvallis. We really want to highlight how we are leveraging that relationship and working with them with support financially from IHN, Intercommunity Health Network, CCO, and support from OSU. It's been a fantastic collaboration. We'll pause for questions there, and then we're going to pivot to overflow sheltering during severe weather activations this last winter. And then just touch upon the Hope Board purpose and how we are working to align it with our current system needs, since our current system has evolved so much since the inception of the Hope Board. So you have this in your packet in bigger form, our community progress timeline. And the first page is looking back historically. The second page is really more recent. I'm not going to read through all of this, but it's more of a visual representation of how far we have come since 5 years ago when the Hope Board launched and 5 years ago when I started here. We really were in a planning phase, data gathering. What does our system need? Where are the gaps? Where does an evidence-based practice system say we should work to go? And then building capacity, creating a coordinated homeless response office with investments from the state, building capacity to go for more funding and also to partner with our partner organizations. And then really in the past 2 years, pivoting from planning to implementation to creating a program and then doing the work of getting folks housed and families into housing. And so just in this past year, receiving funding that is meant for rapid rehousing. And you can see here we are now where we've just received more funding for program support and implementation. And we have our first numbers in winter and fall of 2024, winter of 2025, where we're actually rehousing folks. And that's the first time that the Coordinated Homeless Response Office has been doing that. Our behavioral health housing has been doing housing for many years, but for a very smaller population. And this is really for unsheltered households. So I'll move on from that and pass it over to Rebecca to touch upon these timelines for funding.
Yeah, thank you. So as that more complex timeline shows you is that there was this historic planning and strategizing and then moving into implementation. And so we wanted to outline the specific funding sources that we're utilizing to get us to 2027 with that House Bill 4123 sort of being that overarching operational funding support. And so you'll see that it had very specific purposes around it, which was to develop a strategic plan, also formalize a governance structure with the various different agencies in our community to enable that implementation of the work outlined in the 5-year strategic plan. And then very importantly was the capacity for more dedicated staff to support the Hope Advisory Board and the work that they had established with the leadership of Julie Arena. And so that really is the scope there. We see that House Bill 4123 through budgeting, we envision that getting us to 2027 with that staffing support. Because of where we were at with House Bill 4123 and that capacity, we were in a position to lead our community with the House Bill 5019, which is the budget legislation around the governor's executive orders declaring an emergency on homelessness. After lots of thoughtful conversations with our community action agency, along with Lincoln County and Lynn County, we went forward with actually becoming, as a county, the local planning group for those funds, and with the Coordinated Homeless Response Office acting as the lead for that local planning group. So with that, it also provided more local control, is what we identified in our strategic plan, was acknowledging what role does a coordinated homeless response office play at the county level within a health department. And so that really further, put structure around what we saw as a House Bill 4123 coordinated homeless response system, because it was a pilot. And I would say that this is where it really started hitting the ground running, was with House Bill 5019, with an intentional goal of rehousing 31 households and the funding to do that. And so with that came the obligation to create a plan around that. So we had about 3 weeks to create a local plan of how we would rehouse 31 households by June 30th, 2025. And so using all that community engagement process happening around the whole policy recommendations, the 5-year strategic plan, we were well suited for that, taking that project on. Midway through House Bill 5019, the state came back with additional funding to support local planning groups, with further funding and with increased number of households to house by June 30th, 2025. So we again raised our hand and became the local planning group for that initiative as well. So with both the House Bill 4123 and House Bill 5019, one of the things that Benton County had, already established is that we wanted a sustainable, ongoing response to homelessness. So while these were very exciting initiatives at the state level, our intention was to integrate these into our existing policies and priorities at a community level. And so we wanted to make sure that whatever we established, which you can move it to the next slide, sorry, established with this funding would be a sustainable model moving forward, ways to continue to draw down funds and braid them into the existing fund we had at a community level. And so with that, we wanted to investigate housing programs throughout the state and even internationally. What were ways that we could both continue the 5-year strategic plan goals along with integrating the HOPE policy recommendations? And that's when we came to you with a program model of a flexible housing subsidy pool that had the structure and the diversity of services that would be able to bring in the funds and the services and deploy them in a way that really was appropriate for the coordination that our Coordinated Homeless Response Office was bringing our community. So that is when we moved forward with the Flexible Housing Subsidy Pool. With your approval, we went forward and released notice of funding opportunities, if you want to move it to the next slide, to make sure that we were still utilizing the existing services and programs in our community through our community-based organizations. So we released a notice of funding opportunity there to make sure that we'd have the street outreach component to engage folks that were experiencing unsheltered homelessness, along with the supports upon entering housing, that they would have that ongoing wraparound support, which was part of the flexible housing subsidy pool's, foundational intention was to do whatever it takes to get people housed and keep them housed. In addition to that, through the feedback that we got from our community when we were developing the community plan for the House Bill 5019 and the Oregon Rehousing Initiative with the additional funding, was that we really needed a central point of contact that understood the resources in our community, both from a community action agency, federal level, a local level, and a state level, of what those various different housing support systems were and how to get those coordinated in a way that would support the individual. And so that's where we found that support could come through a program coordinator position, and then a housing navigator that could work with individuals and the case manager to access those services that the program coordinator would be holding an inventory with, and then also just the overarching coaching and support to our case managers. And so here it talks about this weekly case conferencing. One of the things that we have found in the implementation of the flexible housing subsidy program was this opportunity to meet with case managers who are also serving folks in other programs and our own program. And the shared learning that is happening in this space has gone a long way to support case managers and increase the skill capacity in our organizations. So while we are providing funding and we're contracting to these organizations, we are also contributing to the capacity building in our community around a more housing-focused case management model that supports a Housing First program. So, and I'm not sure if I'm handing this over to you, but I'm sure it's still me. So it is, okay. So one of the things that I really appreciate Julie, outlining this documentation, because she has been observing very much what our team has been up to, and I would naturally think to put this down, but I think this is a really, really important component of this. Is we were not a housing program before House Bill 5019. And so we had to hit the ground really quickly and start running and try to figure out, okay, what are all the different components that goes into a housing program? But also, how do we make sure we don't just replicate the existing systems and become another redundant housing system in not another one, just another housing program, and we become redundant. I don't want to speak on behalf of any other programs, but we wanted to make sure that we would not replace ineffectively replace other programs in our community and make it more confusing and draw down funds or divert funds from other programs. And so as we have done this, we have given ourselves a lot of flexibility about how we implement the actual policies and the forms and the different systems, because there's so much flexibility with these state funds that it was, okay, yeah, we could go and basically replicate something else, but what will make this different? What will make us be able to change the status quo with this program? And so that has been possibly, I think, one of the most exciting things, and probably one of the most challenging things, is the time in which we've had to implement this program has also made it so that we're not making perfect get in the way of good. So just to state how much work the staff have done, how much our partners have participated in the building of all these different program components, because yes, we can come to you and we can say, look, we house this many people, but what is really behind the scenes is a lot of work on behalf of the staff coming together and making sure we have all these tools in place so we can rapidly help people make sure that process isn't getting in the way of outcomes. And so moving forward, and just disclaimer, I am on some serious allergy medicine. So I apologize if I'm all over the place. Anyway, I'm able to read the slides, so that's great. So again, going back to the fact that when we saw these funds coming down, we immediately knew, okay, what are we going to be after these funds come and go? What are we going to do when maybe these executive orders are over and policy priorities change? We know we still value and the livability of our community for all folks, whether sheltered or unhoused. We want to make sure this work is sustainable. And so we immediately started evaluating components of our community plan and seeing how we could find other funding sources to help with those individual components, while also keeping those state funds, being that they're very flexible, to make sure that those could be deployed into areas where maybe some of these more niche grants could be focused. And so we went after 2 grants from our CCO, one being the Community Capacity Building Funds, which provides some staffing capacity along with other technology and technical assistance supports to make sure that we could leverage our state fundings for these initiatives towards the actual services to the folks being housed, and have some of our staffing capacity paid for through the CCBF grant. And so actually this week we'll be meeting to talk about so this grant itself provides funding for our staff, but this is specifically to help us understand how to access the health-related social needs benefits that came through the Medicaid waiver. The 1115, which yes, will get us to about 2027 with assurance, but then moving past that, we're uncertain. But knowing that we can sit down and talk to our clinics and figure out how we can also integrate into the rest of the health services team on how we can support our case management supports and our rental assistance through that program. And then I will hand it over to Julie, but again, one of the things, the specific components that we're looking at, was another with landlord engagement and through intentional conversations with our CCO, specifically Alicia Bublitz. You know, she interviewed us a little bit about what we were doing with the flexible housing subsidy pool, and she really wanted us to lean towards the DST for specifically the landlord engagement component of that. So I just wanted to have a little bit of a shout out to our CCO for their coaching and support in identifying sustainable funding opportunities for specific components of the flexible housing subsidy pool. And then I'll hand it over to Julie for what that's all about.
Yeah, well, and also wanting to give a shout out to our Coordinated Homeless Response Office contracted grant writer, Libby Losky-Winter, who has supported all of this additional funding to help our team outline it, document it, get the data correct. And she's not here today, but I want to make sure we give her appropriate respect. So pivoting now to the property manager outreach and engagement, and you should have this as a separate flyer in your handout because it's kind of tiny as a slide. But our DST funding is to provide staff support to reach property managers in the private market. So that means people who own housing or who support housing that is privately rented, and they can charge whatever the fair market rate is. And that really is separate from some of the affordable developments that are here in Corvallis, where those homes, those apartments are kept at a certain percent of area media income, like 80% or 50% or 30%. How do we reach the folks who privately own places to live? Because our provider partners in the community have told us throughout all of these different timelines of outreach and engagement that one of the key barriers to getting folks into housing is that we don't own the housing or we can't access the housing. And so building relationships with private market property managers and property owners is the crux of this DST pilot. What I really appreciate about IHN is that they have contracted with OSU, and so we are getting support for program evaluation from a wonderful woman named Sandy Phibbs at OSU, who sat down with us a couple different times and then came up with this logic model. And it has really helped us because it's not just outlining what the property manager and owner outreach and engagement is, but really what our whole program is. And so the top half of that is what is happening with our participants, the folks who are trying to transition from homelessness to housing. And then the bottom part in blue, how are we reaching out to property managers and owners? That's the PMPOs abbreviation you see there. And then the other thing that I loved about this model and how she put into a visual what Rebecca and I talked about with her over the course of a couple hours are those circular arrows of, as we are doing outreach and engagement and we are educating property managers about what our program is, they are educating us about what they need from our program. And so as we gather information from them, it's helping to inform and improve this program that we newly launched and are still working on to improve. So this is not a one-way outreach and engagement model. We are receiving great feedback from them. And next month, we are hosting a thank you luncheon for them with support from this DST grant to hear their feedback directly. And the first thank you lunch we're hosting is going to be with the property managers who are managing 3 affordable housing locations and are already housing folks from our flexible housing subsidy pool to say, where did we hit it out of the park? Where did we get it right? From initial application to talking with you, to supporting folks, to moving them in, to ongoing support, and then where do we still need to improve? Where is there room for improvement so that we can build relationships in the private market as well? And then one thing I wanted to mention is that this whole strategy aligns with our CHIP, our Community Health Improvement Plan that's across the Tri-County area. That was a collaborative community health improvement plan. One of the main goal areas is we need to work on housing. And one of the strategies was, how do we get access to private market housing units? And so we fully intend to document this as best we can with the outcomes of how did we reach them, how many relationships do we have in place, what kind of MOUs have resulted from this relationship building. And then we want to share it across the Tri-County area to say, here's a model that has worked for us. Because as Greg Moore from COI loves to say, a rising tide lifts all ships. And we want to make sure we do that with all of our partners across the county. Okay. Oh, and then I wanted to mention with some of our property manager outreach and engagement, I'll stay on this for just a sec. We've been able to update our outreach materials to list how many folks we are getting into housing. And so you have this as a handout as well. And we've also been able to say how many property managers we are working with. So we just hit over 10 property managers where we have families from our flexible housing subsidy pool housed at their location. And we've leased up 40 units. And so for private market property managers, this is important. How many people are you working well with and how many lease ups has it yielded? And then from a personal perspective, it's 49 adults, 44 children, and 93 people. And so there's real human impact of this work that we're doing. And these are our neighbors who are most vulnerable. So moving on, Rebecca, I wanted you to touch upon some of the direct outreach that Penny and Mia, our coordinator and housing navigator, are doing. And it's much more on a one-on-one basis.
Yeah, so Penny Ballou and Mia Murphy. So Penny Ballou is our program coordinator, Mia Murphy is our housing navigator, and something that they are able to bring to the network of housing and homeless providers is real intentional relationship building with our property managers, property owners. And what has resulted is really strong relationships and such that property managers are contacting them before issues even get to a point where we're talking about notices or even evictions, and being able to problem solve with them in the moment. So lots of different barriers that we're able to overcome through, reviewing application denials. I don't know if everyone here has recently applied for an apartment recently, but it is becoming really, really challenging out there in the private rental market, where essentially even just a poor credit history can be the difference between housed and unhoused. And having advocacy from a team, both the case management that we're contracting and the housing navigator with the guidance and coaching from our program coordinator, has been essential in making the difference between getting people housed who have tried for many years and have done, insurmountable courageous acts to get to a point where they're prepared to exit homelessness and get the services that they need. And trusting our program is a big thing too. And it is a lot to shoulder for our staff to be able to confidently walk beside folks and try to build in them assurances that this is going to result in something positive for them when we ourselves are seeing how many barriers are out there. So I just want to give a shout out to Penny and Mia for the courageous work they're doing with the most vulnerable. With the partnership with the city of Corvallis, this has been really exciting. I will hand it off to Julie soon, but one of the things in the very beginning, with again wanting to highlight how much we wanted to think outwards when these dollars were coming down, is because we knew we had such a short period of time. And so our partners of the Coordinated Homeless Response System with the staff from the city, Brigitte Olson, Paul Bellata, the timing of when we were rolling this program out with the affordable housing developments that were just being completed was, I would say, nothing but short of miraculous. And so with Brigitte seeing that and saying, look, we've got these things, let's get you some conversations, let's get you around the table with the developers for these to see if there's an opportunity to have set-aside units. And set-aside units are where a program can get preference to a certain number of units based on people's participation in a program, and it follows fair housing and all that. So it's a real protective way and a legal way to make sure that we have a diverse housing stock available for the folks coming into our program. And so we sat down with the 3 different developments, that's 53rd Flats, Union Pacific, and River Green. And we were able to have conversations with all 3 of them. One, finally, we actually have a formal memorandum of understanding, which allows us to have a certain number of units set aside for our folks. When people exit, we can then put our folks in there. The other two, we were able to, at the very last minute, both of them pulled out with the idea of having a memorandum of understanding. However, they are actively working with us, and we're demonstrating our commitment through essentially putting our folks there, and they're able to see how intentional we are about our program and what makes us different. And so we're looking forward to revisiting those conversations with the other two developers. I'll hand it back to you.
Yeah, and just adding our appreciation for the city of Corvallis partners, Paul and Brigida. We're also leveraging their existing relationships. And so they are working with a fantastic pillar of the housing community, Bob Lowen, who knows everybody. And he tracks all the housing in Corvallis, he tracks the vacancies, and he's a wonderful person with great friendships. And so we are working with him to leverage those relationships that he has, so he can provide some warm handoffs and some introductions with specific property managers in the private market who are interested and could be inspired to work with us. And so these are not the affordable locations. These are folks who privately own properties. And so I really want to thank them for their collaboration on this so that we can continue to pursue private market rentals. And so this is just a breakdown of what we've already stated, but we are working with 3 affordable housing development locations, lots of families. The stars aligned that affordable developments needed to fill hundreds of homes at the same time that we launched a program. And then 8 private market property management companies already are working with us. So we are having success. We have folks who have found housing that they preferred in Philomath. And then we had a handful of out of county locations. So flexible housing subsidy pool participants who said, I want to live in Sweet Home or Lynn County or up by Portland. And so it was our team's job to help them find a place to live. We're no longer providing the support and case management because they wanted to exit this area and live somewhere else, but still the housing placements were successful in other areas. Sometimes housing placements are not successful for that person, but it has been less than a handful of times out of more than 40 households who have been housed. How do we still make that a success? I want to give a huge shout out to my colleague Rebecca, who has done some real work to make sure that things don't lead to eviction, even if the housing placement is not going to be successful for that person. So Rebecca, I'm going to pass it back over to you to talk about your work with Faith Hope and Charity and our other partners.
Yeah, so if you do have the flyer that we designed for our engagement with property management and property owners. Number 3 on the back page, maintaining housing stability. The second point, if a conflict cannot be resolved, the housing coordinator and case manager work to move the client out of the housing unit so an eviction is not on client's record and the property manager is able to quickly turn the unit. So I would say that a lot of the shout out is to Penny Blue on this particular one, where we have a photo here of Faith Hope and Charity, Johanna Hamilton, who worked with me because we actually had a lot of our staff at a training the day that Penny had set up several contractors to be able to help with a tenant whose housing placement, I will say, was successful. Yes, it didn't work in that particular arrangement, but one of the things that we wanted to make sure, this was our opportunity to demonstrate our commitment. And again, when we came to you over 8 months ago about this program, and we said, look, what a flexible housing subsidy pool is built on is a customer service model for the household and for the person who has the investment of housing. And so, you know, I would say when Penny and Mia and I sat down and we understood that this was coming up and there was absolutely nothing we could do to prevent the requirement that this person exit the household, it was okay, well, how can we demonstrate to the property management company that when we promised this particular thing that we meant it? And so we worked with a moving company and a cleaning company, but there was a lot of work that had to happen well before those 2 contractors were even able to get access to the site. And so we worked with the individual who initially was agreeable, and then in a little bit of time, they you know, were just like, I don't want to do this. And so it took a lot of that real one-on-one work and case management skills from the whole team, both from Corvallis Housing First, Faith Open Charity, Mia and Penny, and just going there and working with the household to organize themselves in a way that would prepare them for exiting the unit. And then, so we were able to successfully exit them from the unit. I actually was there and actually finally made one-on-one contact with the person who I originally had been talking to about the memorandum of understanding that they, at the last minute, said they were not interested in. I was able to go in there with my coveralls and say, hey, I'm Rebecca. I'm the one who talked to you about that memorandum of understanding. Still want to talk to you about that. And they said, oh, okay. And then after all said and done, and we were exited the unit, we, turned the keys, and they called me the next day to tell me that they had openings at another unit in Corvallis if we had folks that we wanted to send there. So it was just really putting in that extra work and just having also Johanna there. She's like, this is real, and just, demonstrating through our community agencies and community-based programs that the county is here to help. And I think that's just been, we continue to hear from just the caseworkers how much they really value the resource of having the housing navigator and the program coordinator and the staff here to ask questions when they're out in the field of just what do we do about this, and talking through role playing and different things like that, and going with them to make visits with the folks has just been, they just keep expressing gratitude in this program. So yes, that particular housing unit didn't work out, but overall we have a case manager who's visiting the household regularly, even though they're no longer in housing, because our goal is to get them rehoused. So it's not just once you're housed you get our services, it's throughout your entire housing stability journey, which can include re-entering and exiting and re-entering.
Yeah. Also, this was a gap our community said they wanted us to fill. So this wasn't the county leaning in saying, let's just do this work. This also came out of our local planning group effort with House Bill 5019, of our community partners already out there doing it, saying, please lean in. This is where we need gaps filled. And this is a recap of the program successes. The last number I pulled from our spreadsheet on April 8th of 43 households, 52 adults, 44 children, for a total of 96 individuals. So that's been updated even since this flyer was approved, because our team keeps getting folks into housing. And then just wanted to touch upon the work that the city of Corvallis is doing and where they are leaning in their role, because the city, they have capital for housing acquisition or building. And so they are doing it as well. They're leaning in where they can, and we partner with them all the time on this. They have already purchased a property on Van Buren. I know that you've heard about this before, but just wanted to touch upon it, with at least 7 housing units upstairs, and then other resources on site downstairs, some possible communal medical respite, and area for supported services to happen, or an AA meeting or a rent well class. And that's a partnership with us so that we can help provide those supportive services through the FHSP, and make sure that we can help place folks in that housing. And then the city of Corvallis is pursuing being able to purchase another property on Harrison. It has not gone through yet, and it needs to be reviewed and approved at the federal level with HUD. And as we heard, a lot is uncertain there. So this one is a hopeful being able to purchase, and it would be 6 bedrooms in a single family home that would be used in a similar way, where the FHSP would help to place folks in that location. But that one is a fingers crossed.
And the update for that one is HUD approved it. They just have to check if money's still in the account.
Oh, cool.
So of the various different approvals that are associated with our climate, you can get written approval, but the money may not be there. So,
and it may come with restrictions that you aren't aware of yet.
All right. And so because of the potential inclusion of this Harrison property into the portfolio of housing units that the city is partnering with the county through the flexible housing subsidy pool. I just want to back up a little bit that because of the county leaning in with the flexible housing subsidy pool, that is what was sort of an inspiration to the city to lean in about acquisition of housing, because they really wanted to make sure that those wraparound supports would be available for people who were utilizing that. And so it really was, we took a first step forward, and it was a bold move, and the county or the city was right there behind saying, hey, we're ready to support you. And that was really established through the ongoing agreements that were established with the Home Opportunity Planning Equity Advisory Board, with the city and county going into that as a joint relationship. And then also the memorandum of understanding for the homeless or the Coordinated Homeless Response Office through House Bill 4123. So this is those promises in action right now. This is the implementation of that. And I think sometimes I lose a little bit of sight of sometimes what these different documents and historical documents mean. This is what it means in action right here, is that we are now moving forward with the city looking at ways to continue to sustainably acquire or gain access to housing units that are not subject to the private market, because we know that is an important part of the stock, but we also know in order to serve the highest vulnerability folks in our community, we need to be able to have access to housing that isn't going to screen you out for low credit scores and different things like that. So what we did is, with the inclusion of the Harrison property, we realized that the original intergovernmental agreement that was for the Van Buren property was so specific to that site, and even the conditions under how that IGA was developed had changed since we developed that, and realized, what we're talking about here is an overarching program and an initiative where the city is leaning in to find housing units, and the county's coming forward with services. And so we shifted it to an overarching, more of a, hey, we agree to continue to partner with you going towards what you're good at and us doing what we're good at. And so we're actually returning tomorrow to the Board of Commissioners with an intergovernmental agreement that will outline this commitment, and then we will move forward with specific contracts for specific sites, knowing that specifically with Van Buren property, you have individual apartments, whereas the Harrison property is a single family dwelling with 6 bedrooms. So definitely different kinds of service models for each of those sites, and consequently needing different contract models to cover the different kinds of financial relationships with those things. So.
And also, this aligns with one of the other strategies from the CHIP, the Community Health Improvement Plan, of not only do we want to access private market units, how do we acquire them and add them to a publicly owned stock of housing, so we own the keys to the kingdom and we can decide who goes into those housing units for folks who have the most barriers to get into housing. So I wanted to mention that again. We have a recent funding announcement. Rebecca, I think you wanted to touch on this one, and then we'll pause for questions.
Yeah, so the Oregon Rehousing Initiative, which was the additional investment to the House Bill 1519 funds, they actually had some additional funds available. So they released a competitive grant that was called Behavioral Health Housing 360 that would follow much of the same program structure as the Oregon Rehousing Initiative, with a hyper focus on behavioral health housing. It was a highly competitive grant. We had very limited time to prepare. It seems to be the style here, but because we're used to it, and because of being able to have all the documentation for previous plans and our partners at Behavioral Health, we were prepared and ready to go after this funding opportunity. Ultimately, we applied for $1 million. April, I think, said, "Let's go big," is what you said, I think, and I quote. So because we said to them, look, for us to have a behavioral health housing focus, we better have all the other components supplied, because we need these housing supports, and the flexible housing subsidy pool is already partnering with other agencies in our communities. So we need those investments to be viable, ongoing, and be able to focus on our folks that may not be engaged with behavioral health, or due to their housing status have challenges accessing those services. So we pursued this, and we were awarded $900,000. And we actually met with the state last week, and we will be working in a cohort, which is pretty exciting, with all the other different, the other recipients, which includes Washington County, Mid-Columbia Action Agency, and oh my gosh, I think it was Marion Mid-Willamette Valley Action Agency, correct? Okay. So there's total, that's 4. Okay, my math is correct. Yes, there's 4. And so it's a really nice, diverse recipient body and cohort, because we have 2 community action agencies, one from a metro or somewhat urban metro environment and a rural environment up in the gorge. And then we have a county, Washington County, which is our metro area. So it's really exciting to be able to participate this and do some really shared learning environments. And I would say that the meeting with the state was pretty exciting about what they described their intention around this pilot. I don't know if you want to speak on anything that you heard there.
It's really, really interesting. I'll share, when we were working through the grant application and through the process of meeting with OHCS and others, the governor's office with Damien and Rebecca and others, we heard the phrase kitchen sink a couple times. Grants and pilots often need to be pretty defined, but we really held to the fact that, as Rebecca said, we need to have all elements covered if we're going to be able to do this right. So in that first meeting last week was really interesting that, our focus on a pre-treatment model, getting intensive street outreach and other behavioral health services, case management services out for folks who have behavioral health needs, to get them to a place where they're ready for housing. There's that component, and there's these already identified populations of folks, those who are engaged in aid and assist, those who are exiting Oregon State Hospital, those who may be assertive community treatment team clients. So it was interesting seeing the kitchen sink come back in as a necessity after us sort of fighting to keep all of the kitchen utensils in our plan. So it's worked out in our benefit. It's going to be a lot of work and a great partnership with behavioral health and other partners across the system.
Thank you. Yeah, it is. I'm really excited about the opportunity for shared learning in this. It's opportunity for creativity, and that's what we kind of asked the state as well. We really want an opportunity to see how we can, especially with our partnership with the city. If I didn't have so much allergy medicine, I would be able to form my sentence better, but I think it's more emotional than it is that I need to articulate. But yeah, I'm very excited about this opportunity.
We are going to cover overflow sheltering during the winter, but we wanted to pause here for questions on what we've already covered.
Yeah, I want to do a brief time check too. We do want to make sure that we can get into a little bit of deep dive with the crisis center planning pieces. So if there are pieces if there's a way we can summarize as much as possible that next piece, and then be able to come back for one-on-ones as your questions.
Yeah, I mean, these are just recaps of number of individuals, and you have this in your slides, really just a snapshot of how many people were helped during overflow sheltering, and that we were activated for 26 nights over 2 months, and county staff provided a huge amount of overnight staff support. And if you want specifics on the numbers over the dates, we were over 100 for many nights, and this is all included in the packet as well. We're going to touch upon the evolution of the Hope Board, but we don't have much to share yet, other than we are working on it, and we're going back to the Hope Executive Committee in June with some possibilities and proposals for what we need from the Hope Board now that our system has evolved so much. And that's all in your slides as well. So we really can't answer questions about that. The work is ongoing.
Thanks. I don't want to take away from any Q&A or discussion that wants to happen. I just want to make sure that we're.
Yeah.
I have one question, hopefully it's quick, if not, we can take it offline. When it comes to getting people rehoused and the sustainability and keeping them there, what is the strategy with paying for the rent? Does that come out of our grants? Is that HUD vouchers? Or
And Sam, we can stop sharing. Thanks.
Yeah, so both the House Bill 1519, the Oregon Rehousing Initiative, all those grants and eligible activities are the direct rental assistance. And so for folks who enter our program who are not receiving a Section 8 voucher or some other type of rental assistance, they get rental assistance directly from our program with the goal of we can provide up to 24 months worth of rental assistance. And so the idea is working with them to access Section 8, which has a long wait list. So looking at ways that if they do have other types of prioritization, getting them on to applying for preference vouchers, which allows them to bypass the wait list. But that is still a wait time as well. We are hopeful to evaluate other types of rental assistance programs working. We have currently a memorandum of understanding with our Community Action Agency, CSC, to look at ways that we could possibly refer people to their program for rental assistance. But much of the rental assistance programs that are outside of our program that are those midterm, like the 6 to 24 months, you have to be experiencing homelessness to be eligible. So if you're receiving rental assistance from our program, really the idea is that we would need to find support programs that don't have that homelessness criteria as an eligibility. But the idea is to get them onto long-term rental assistance like Section 8, or look at ways to get employment or other types of cash benefits that would be able to provide for their housing.
So they know going in, this is a finite period of time.
Absolutely.
Thank you. Any other questions?
Yeah, I'm back to working with the private property managers and landlords. I'm assuming Corvallis, this area is a tight housing market. I mean, is that accurate? And so
Has been historically, Commissioner Malone, sorry to cut you off, but things are changing. The one who's sharing data with us, there are quite a few vacant 3-bedrooms, and prices are even going down in some of those larger units. And so we are going to leverage that as much as possible.
that's what I was trying to understand the current situation, and it seems like you would get more cooperation if there was some slack in the housing market.
We are seeing some of that, and we're going to continue to work with Bob to leverage his relationships to identify where there are properties that have had vacancies ongoing or are lowering, because he knows that information.
So we are making some progress in the number of housing units that are available.
We're working on it. We just met with them a week ago. It's ongoing.
I know that to add on to that point, there's some city councilors on the city council in Corvallis who are interested in addressing vacancies that have been sitting open for an extremely long time because landlords are not willing to be the first one to reduce their price. So there are some councilors who are interested in pursuing ways to address that.
Thank you. And I should have also applauded the city of Corvallis for their recent efforts to acquire properties. That's worth saying, yay, again. So,
They also were instrumental in making sure those affordable developments were attracted to develop here and supported locally.
I really appreciate their support and partnership and all the work that you guys do.
Amazing, 5 years old. I think where we were 10 years ago, this is amazing.
We need some good news in this climate.
Yes. All right, Damien, behavioral health update.
Good morning. to jump in where you need to, I think we'll handle this between the two of us. So,
Stacy might be online too, I'm not sure.
Yeah, she is.
oh, she is, perfect. Then, Stacy, I'll lean on you if, as needed, hopefully. Stacy has been fantastic, big shout out to her. Before I transition in, I actually want to really acknowledge the work of this team in terms of what they brought us into around the behavioral health and housing pieces. What you may have heard at the end of that, speaking of voices, allergies and all the rest of it, what you may have heard at the end of that is that the last meeting with the state was a definite focus on a more acute population. So that is our wheelhouse, right? And that is a big pressure point for the state right now in terms of age assist and a lot of things that are going on around the state hospital. So I really want to acknowledge that this work is also about being upstream, preventative. It's about helping people before they get to that place as well. It's not just about this one population. And to me, that's a rarity in this day and age because we're so in crisis mode. And with that transition about being, sorry. Let's talk about the crisis center. Yay. So, okay. So this really is an health service. I mean, a behavioral health update per se. This really is more focused on our crisis center. As you are probably seeing firsthand, we are almost there. The building is looking fantastic. We've been doing a lot of tours on it, of which you are all due for one imminently. There are some updates even within this slide. That's how things have been somewhat in a place of transition in terms of where we're at on our timelines. So the focus for us is that we have our existing services that we are obviously engaged on a daily basis. We're going to be moving to a stabilization model. Stabilization is the easiest way of thinking about that is a person who's in a place of that sort of crisis and or in a place of just challenges for themselves for that day, in which we would offer them a 23-hour place of just a little comfort and respite. Think of that as the downstairs program, right? And then where we're going to be transitioning for is for the first time behavioral health is going to be entering into a 24/7 model. So that we're going from traditional sort of work hours to now we're going to be expanding the weekends to now we're going to be going to the evenings and eventually going into overnight. And you'll see this reflected in both our timeline and our service delivery. But I want to put some context with this as well. We're trying to be driven by the service need in terms of what is best for our community, but there's also an acknowledgement there are some financial limitations that we have to acknowledge and get into. So how do we navigate these waters? I mean, talk about context as well. I mean, everything today's discussion, it's all context for that, right? What is going to happen at the national level? What's going to happen at the state level? How does this play out? We're about to enter into a brand new book of business. How do we set this thing afloat, sail, keep it going successfully when all of a sudden all these things are really in a place of transition? I call that my small ulcer. That's what I tend to address it as.
Is there a big ulcer?
There's a big ulcer as well, and that's just about this when you can officially cut the ribbon. That's what I'm hoping it's going to. So first one, May 7th. That's it. This is fingers crossed. This is what we were hoping for, was for the keys. I'm going to give you a small update that I received. Stacy, are you on the call? Let's see if she comes through.
I'm here. Yes.
She's on.
Okay. Oh, she off.
Oh, she unmuted. If you're talking, Stacy, we cannot hear you. But I see that you unmuted.
Okay, not to worry, Stacy. I'll see if I can call on you a little bit later again. Maybe we can work the audio stuff out. Maybe it's a sort of jump on, jump off again.
And I can see her. She came on. She's
there.
On her camera, so she's there. Yeah.
Okay. So basically, we have ongoing updates from our builders in terms of where things are at. So we have had an update, and I'll get into that a little bit further on in terms of when we can actually quote unquote get the keys to the building. Depending upon that, that's obviously going to be related to our open house. A quick shout out as well for our communications team. Oh my word, both on the health side and on our PR front. You guys have been crushing it on just being really responsive. very creative in what we can do, how to sort of get all these moving pieces together. I think for the open house piece, a lot of this will be contingent. So just please, you see those dates up there. Let's take those dates off and just know that it's going to be pushed back a little bit. And that really what we need to do, and as well, is have a discussion around when is the best time to utilize an open house for you guys. And what I would say is this, what makes it super easy is as I talk about how we open the overall program, the easiest solution is you either want to be on site when there's no one there, right? So we'll have a big to-do then. Or assuming that things move forward and we open, the weekends will be still available to us as well. So that might be an option as well. And then as we expand over, that will go. But I'm going to lean on my communications crew to be able to really sort of keep you all in the loop and understand what that's going to look like. So our goal, which said June 2nd, now could be a little bit later potentially, is going to effectively move the existing building, which is at Humphrey Hoyle, and we're going to effectively take those services, pick them up, move everyone across. Folks at IT, IT have been fantastic in terms of just keeping us apprised of stuff and where they're at. We will effectively move over a couple of days all of our team into that building. So if you can think that there should be relatively no interruption of services, and then we're just going to continue on as per usual. The next iteration is going to be right around August, and that's when we're going to take those existing services and we're going to split the teams into two modalities. So we're going to have a 4-10 model. So we're going to shift our staff going from the traditional 9 to 5, 10 hours, 5 days a week, moving to 4-10s, and we'll have an overlap in which basically, if you can think of it as the overlaps will be on Wednesdays and on the weekend. So on the weekend, we'll have one team for a Saturday, one team for a Sunday. The overlap that this allows us to do is 1 week, one team do administrative work or the paperwork, because I will tell you, clinicians love to do paperwork first before anything else. And then there would be no excuses because they have the day to do all the paperwork. And then meanwhile, the other team will be doing the direct service stuff. And then just flip that the following week and the other team gets to do the same process. Then the next iteration is going to be a swing shift. So what that means is basically we're going to then duplicate that process, but move that into a swing shift, which will give us services from midday through to basically sort of between 11 and 12 p.m. On that night. And then the last lift, and this is the sort of still to be determined, is going to be graveyard shift. And then the big still to be determined is going to be upstairs respite. So let's see if I get into some of these, because I want to dig into a couple of those pieces so that you understand what we're thinking from a financial standpoint. Okay, I'm going to switch out 2 of these. The first one on track is construction. We're going to move that into being a little bit behind now. So we were notified that one of the challenges around this building, one of the beauties around this building is that if this was a traditional building just like this space, the square footage for this space versus for the crisis center is exponentially cheaper. The reason why it's more expensive is that because of the setting, we have to do multiple components related to the safety, related to structure. So if you can think of like anti-ligature stuff, right? So in other words, you would have to have something within here that you couldn't tie anything to. And you just look around this room, you can sort of come up with a lot of examples. So in this type of model, and it goes right down to doors. And the type of doors, the door has a traditional handle on it, right? So we would have to have a door with a different type of handle on it. How the weight of that door, how the door operates, that type of level of complexity that has been put into it, which is fantastic, but it also makes things more expensive and it delays things. And what we just found out is that for the door jam, right around that door, we just found out that a third party who was involved in making those, they had sent those in and basically they got returned because they weren't up to what we needed. Which was too bad. But what that means for us now.
Doors?
We got the
Minor
doors.
problem.
Minor problem.
We'll get around to
Doors, right? Yeah. So as you can imagine, doors are kind of important. It isn't that many doors. It's only like 4 doors, and they're but these are, they've got an interest, they're called wicket doors, and it's a specialty type of door that we need to have in place for any of our clients. So we have all our traditional doors are in, specialty doors are in. So it's going to put us not a lot, we're only thinking a couple of weeks, but it does push us back a little bit. And then I'm going to flip that with staffing hiring. We had a rush of activity last week. I think we're now back onto being on track on the staffing hiring piece. And then the last one that we're on behind, and this I don't know if it has a solution, but I will just call it out here, parking. So parking is a premium. We don't have a lot of solutions around this. I would put this out. Everyone is aware of this issue, but one thing that we're hoping is that maybe the city of Corvallis will take pity upon us and offer us some creative solutions to how we might park downtown.
You just kind of threw that one out there.
Yeah, just, we're sort of hoping that there may be a solution there. Well, because initially we thought, okay, we'll just have traditional parking spaces. But as you know, there's a lot of change in what they're talking about now for the downtown parking. And that might shift away from being interrupt-free parking to now being, I think what they're talking about is a zone. Is that? I'm not.
How many spaces are you looking for, Damien? This is brand new.
I think maybe 5 to 10. Paul's aware of it, but
And is your team already working on it so that
Yeah.
commissioners need to get involved?
Sure. Because I monthly with Mr. Shepherd to discuss these
it
things.
might be good to try. I think.
Sure, yeah. I'll just share this. That's Stacy, our project manager, it's been identified as an issue, longstanding. I know that back in the early days of planning, it was known that it would be a conversation, in addition to having some discussions with city. And maybe it's just for county vehicles, and maybe there's something else that we can try to look at for staff parking. But in addition to the city, there's been discussions about maybe approaching various businesses around that don't use their lots to the extent that they are. So I don't know if Stacy has audio now. I'm not sure where the status of those are, but I do think that at least for a couple of the county vehicles,
would be awesome.
City conversation would be great.
Really great.
And city may not be the solution, it may be a private sector solution as well. So there's lots of different IGAs out there.
And like I say, I think the reason why this sort of came back on the map is a little bit is I caught a discussion around the changing in the thinking about the zone, and which would, I think, that's about, I know about that much on that subject, but then when that popped up, I'm like, oh, this is going to be a shift. So, okay. With that, I'll get back to all the great stuff, which is we're on track on nearly all the other fronts. I'll call out the last one, and that is the budget. So, when we say that we're on track, I'm going to actually go back to the previous slide. Well, I can follow. Let me go back to this one because I think it'll be easier to see this. So I'm working with finance, in working with IHA, and just talking about some of these challenges. So we know there's the stuff that's outside of our control, which is obviously the national and effectively the state. We've navigated this. I think everyone's getting kudos today. Kudos to finance on this. I think we've navigated between all of the hiccups that we could have had around additional expenses. I think we've navigated this really, really well. And you may have heard some of the rumors of the environmental issues that were associated. I mean, these two commissioners most definitely have, but between that and $1 million shortfall, the ARPA funds now being secured in terms of our startup funds. So we've managed to get this to a sort of a cost neutral on the budget front for the building side, which is amazing to not be in those places. So, between Rick and everyone, I think for all of you who've been involved in these type of processes, it's so easy to have that sort of scope creep and you get into those sort of issues of costs.
So to dig a little deeper,
Yeah,
I'm trying
please.
to remember
No pun
back
intended.
at some point, we approved the IGA, and I think it was with maybe the state for some funding.
Yeah.
And it laid out number of beds and respite and all this stuff. So even with the delay and the staggered implementation, we will still be compliant with the
Yes.
IGA.
Yep. And so the last piece was really about helping to offset those startup funds in terms of what we are incurring with a heavy focus on stabilization, which is where we're at. So the reason why I talk about the financial component is what you're probably going to hear or see in other discussions is really to make the difference. It's the difference. And what is the difference between what we project on our financial revenue side, our grants-based side, so all our revenue streams that are coming in, and the gap between being able to stand this up as a self-sufficient model. That's where we want to go to. We want to be cost neutral on this in terms of how we maintain this for both staffing, but also obviously so that we have a service to provide in the community long-term. For us to be able to effectively do that, we have to then mitigate some of those costs through an offset of IHN. Here's the rationalization for IHN. So IHN as the CCO is going to say, okay, you're setting up these unique services. To do stabilization, what does stabilization mean for us? Stabilization means to us, when we're talking about it from the hospital front, instead of an individual who is in a place of need and or crisis having to sit in the emergency department, as you would imagine, all of those costs, all of the additional stresses that either for the person and or for the staff to be able to remain in there, this becomes an alternative to that. This becomes a really therapeutic environment in which people don't have to spend their time in that space. That, from a diversion standpoint, if you're familiar with the cost of a one-day stay at ED, it's substantial. So when we look at the cost modeling associated with this, we know that Deschutes County does a 30% diversion from ED. So if you start to monetize that 30% diversion and you put that back to the CCO goes, oh, not only is it good client care, but we're going to save money. We save money for our system. What that allows us to do is then to make that ask. That offset allows us to make the differential that we're currently in, because right now it is not a cost neutral model.
By ED, is that emergency?
I apologize, yes.
Okay.
Emergency department.
Emergency blue.
Exactly. So if you think of a person who's just in that place of crisis, they traditionally go to ED, they sit there, unless it's a medical condition, but let's say they're in a behavioral crisis, they would then sit within that environment, wait to sort of get to see somebody, hopefully get to a place of stabilization within themselves, and then either effectively get referred or referred on to another.
And what is the percentage you think of costs?
So we and this is where the cost this is the next iteration is going to be our cost modeling, but they perceive a 30%. So if you do like napkin math, you're talking about 9,000 to 10,000 total utilization of ED for one day. Mm-hmm. You multiply 30% in terms of individuals who come through us. You multiply that by, say, three to four individuals a day. You do the math out. It starts to pencil out for IHN in terms of where their costs are, which is great. And here's the challenges. So be mindful of time. When this model was initially stood up, the state, and like everyone in the state, was really into crisis stabilization programs. Like, this is going to be the way forward. We need respite care. We need all of this. Now, this is kind of like the last group that used to be at OHA. They've all since transitioned. So at this time, they're like, we're going to get stabilization. We're going to pay for this. We're going to come up with the rules. We'll come up with the budget. Well, things change. All of that kind of went out the window a little bit, and that doesn't really exist. What I can tell you now is there is legislation that is a part of wanting to put these pieces into place. But right now, the focus is on all of the more acute populations. State hospital population, aid and assist population. This is where the lens and the focus is. The challenge with that is that what we want to get into is more around preventative care as well. We want to keep individuals just happier and healthier and more stable within our community. So we want to pay for those pieces. we don't currently have a billable code that can formulate and stabilization. So myself, my counterpart over in Lincoln County, my counterpart over in Lynn County, down in Lane, up in Washington, we're all currently talking about and/or building stabilization programs. Everybody's engaged in it. So, they sort of set the ship on the water off a sail, and then now it's just kind of floating out there. So what we have to do when we're moving through this financially is be very prudent in the way that what we onboard these services. What we know right now is that we can engage in discussions around stabilization and come up with an effective model to make this work with the support of IHM. The big question then becomes down the road is once all of this stuff is settled, has the state caught up with us so that when we're ready to do respite, they're like, yes, here's your new rules. Here's your new funding stream, and this is how we're going to do it. Now, to be clear, there's lots of opportunity, there's lots of processes. I am not worried about the long-term solution, and I believe we can get to this place. It's just being also a little bit cautious instead of just running along and switching the light and saying, well, let's get this thing going. It's to be a little bit prudent in the way that we onboard this process for respite as well. So the goal is to really focus in this year is going to be on the stabilization, giving us a bit of time to look at the respite model and see what the state has pulled up with around this. And just so you know, everyone, all of us, so AOC, and HP, has all been engaged in these conversations with the governor's office about this need. So that is the one little caveat that I would sort of add to this process. Overall, what I feel really good about this is that I think IHN, and you've heard about IHN being a great partner in this last project, IHN is really invested in this as a solution. We have now that all the work, HR, April, myself, we went through our bargaining process. That's been completed. So now we have all the pieces that we have needed to now go back and make the appropriate ask. So Debbie on Rick's team has put together a sort of an A/B and a scenario for us to go to do the financial ask, and we have something that I believe that they can then work with to give us back what hopefully will be our ability to then have this as a cost neutral to the county, which is the ultimate goal. That way, there's no GF going into this. It's self-contained. And we have the lights on.
Perfect. Just all that.
Just all that. That's it.
Yeah.
We'll just take care of it.
Yeah.
That's how it's all been going. It's just, and I can't give it. One more shout out. Ricky, who's been the project manager throughout this process. Mm-hmm. I do not know what I would have done without Ricky. He has just been such a caveat. So between now Stacy and Ricky, they've just been a great team and have really been keeping my mental health in a really good place. So big shout out to them, Commissioner.
So we had our CCO meeting last week, and it did come up near the end of reports. There was inevitably these meetings have 3 hours of material shoved into 2 hours. So at the end, people are going really fast to try and make it happen. And so someone did bring it up, and I thought about it afterwards. So getting the CCO board to get a tour of the facility might be a good idea for this.
Great idea.
To facilitate this ask at some point.
Yeah, no, that's a brilliant idea. And do you think was it Todd who brought it up? Was it?
No, Todd, no, but he had thoughts about some other things. But it was a Samaritan staff person.
Oh, okay.
I still don't know who everybody is yet.
Might have been Robert Fallows that talked to that. Anyway,
perhaps. Yes.
Yeah. Okay, that's a great idea, and we will follow up on that opportunity. Yes, we have
I've got them on the list now.
Wonderful. We have a communications meeting. I think Friday. Is that it? Yeah. So but that's a really great idea to loop in the senior IHM leadership to help with the ask.
Okay, we got 2 minutes left.
Same kind of comment, more of a general. We've been talking about this facility for a number of years, and it's almost here. Mm-hmm. We've gotten good support, whether it's from the state or federal, and make sure that those folks have the opportunity for
Yes.
touring and say, thank you
Public
for
acknowledgement, for
your
sure.
support in the past, and we would like some more support in the future.
Yes.
It's, I think, in this window between when we get the keys and when it's operating, take as much advantage of that window as we can.
Yep.
Whether it's community leaders or I assume at some point it's open to the public for an afternoon.
Yep, we'll definitely do some staging around the open house process, and these guys have been really good involved in what that might look like, how best to do it. April's team on the communication side as well, so a lot of experience around that open house model. So I think we will definitely be able to meet all needs on that front. Just teeing this up, obviously, folks like that usually need a lot of runway to be able to make the appointment. So we will try and get that out. I think that's the goal, is Friday to identify these pushback dates and to now reset that and come up with a new set of dates that will be available for you folks. Yeah.
Great.
Yeah, for sure.
I mean, it's a great program. It will be an even nicer looking building.
It
with
is a beautiful building.
landscaping and
Yeah, I went there last I did one more tour last week, and for hopefully our new crisis manager. One of the things I love about that place is it's so incredibly light on the inside. It doesn't feel institutional in any way. It really feels like a place in which wellness and respite can happen, which is what their goal was, and is a real departure, I think, from traditional clinics and how you would think of it in the past.
And that just, I think, reinforces the need for getting as many people to see the building on the inside as we can, because for the foreseeable future, we'll be driving past it, and to have that image, light, and we're
Agreed.
this is part of the solution to some of our problems.
All right, very good. Well, thank you everyone for attending. Thank you for all the helpful information shared. I want to acknowledge too, we had a couple of our HOPE Advisory Board members online, including our co-chairs. Thank you everyone that took the time. Thank you, Stacy. And with that, I will adjourn the meeting at 12:32 p.m. Thank you.